This is in a way inverting the status quo, because usually when we think of guidance, it either comes from WHO, Global Fund, Stop TB Partnership, or the national programs. But this guidance has been really led by the community and has been supported by everyone who is here today, especially those around the table. And I really would like to thank each one of you for your continued support to the communities. If we needed a year of the policymakers to get this moving on the ground, we couldn't have asked for a better group with the ability and the power to make a people-centered and rights-based TB response a reality.
We needed something that takes the rhetoric of rights and moves towards the reality of rights. So the rhetoric of rights in the political declaration and in other parts of the response is the language of human rights and a rights-based approach that has seeped into the response. That in and of itself is an enormous achievement. 5 years ago, those words, human rights, the right to health, they weren't a part of this discussion at all, almost. So that's a huge step. But the next step is to really make concrete and actionable a rights-based approach. And so that's exactly what we're trying to do with the help of all of you with this document.
It's time for us and for the international community to renew our commitment and to redouble our efforts for the millions suffering with TB each day and their families. To end TB, there is no question that we need new and better vaccines, diagnostics, and therapeutics. But new technologies alone will not end TB unless they are underpinned by human rights, as you said, Blessina, very, very nicely. Tuberculosis flourishes where human rights and dignity are limited, but can be vanquished when rights are respected and upheld. While anyone can fall ill with TB, like so many other diseases, it thrives on the most vulnerable, on the marginalized, discriminated against, and poor. Progress in ending TB must go hand in hand with other efforts to reduce inequalities, eliminate extreme poverty, ensure social protection, and achieve universal health coverage. And as you rightly said, that's why people-centered and rights-based approach is central and should be the foundation. Alongside efforts to expand access to prevention and treatment, we must fight stigma and remove discriminatory laws if we are to achieve the targets and commitments we have made. As I have said many times, and as I will keep saying, health is a rights issue. And WHO was founded in 1948 on the conviction that health is a human right for all people, not a privilege for the few. That conviction remains central to everything we do, and it remains central to the fight against TB.
The human rights framework provides a more useful approach for analyzing and responding to modern public health challenges than any framework thus far available within the biomedical tradition.
In the TB world, too often, there are two sorts of human rights abuse. There is the human rights related barrier people with TB face in getting treatment in the first place. And then there's the human rights barriers they experience when getting treatment. And in particular, the latter was a very different thing from what we've seen in the HIV world, where notions of patient agency and patient decision-making and consent were developed far earlier than they have been in the often quite kind of medicalized, I think Brian put it, a world of TB. Now, actually, I think we've made some significant progress, even in the last couple of years as a community and in the fight against TB and in the way we infuse that fight with a human rights approach. But by no means have we finished, and of course we've got more to do, and this is why what you've launched today, I think, is an important step in driving this forward.
That is very clearly articulated in the document that people should have the detailed non-medical information, easy to understand information about it, and that is must and that needs to be addressed. So I am very extremely happy that even though late, this document is now is out and it should be implemented by the administrators, state administrations, national, subnational, every level. It should be implemented as soon as possible, so that the human rights approach to addressing tuberculosis can be taken care of.
But for me, is very important is the human rights response. It is just not helping the patient getting treated throughout the journey of tuberculosis, but ensuring each and every right that we feel, because we have experience. I think we are the best counselors who have survived the disease, and so we know what right is very important, and that right has not to be deprived.
What a human rights-based response means for me, it means that people in prison have access to information on TB, prevention, diagnosis, treatment, care and support. It means prison reform, ventilation, nutrition, access to prevention and diagnosis and treatment, etc. in all prisons.
We realize that there are interventions like community engagement, engagement with civil society, human rights intervention. These are the ones which will take you to the last mile towards the end game. So the importance of human rights and communities cannot be understated. The other issue is that communities bring the perspective of a disease because they have gone through the experience of having the disease.
To bring forward all the aspects of the genuine engagement of communities, respecting all the rights, and ensure that the TB response is centered on the human rights, is centered on the gender, is gender sensitive, is ensuring no stigma and no discrimination. And to do that, it's very easy to say you need to have tools and you need to have people. Now is the time to play. So the time to play means that we need to go at country level and make sure that we have the right interventions, including in the NSP, in the Global Fund proposal, funded, implemented and monitored, and then we see a change.
Actually, I'm taking it very personally as a brief for me, for my colleagues, and not only here at headquarters, but also at regional and country level. And I'm already using it very actively. You know that right now there is ongoing work on the UNSG report, and I ask to revise literally every line to avoid this, you're calling here discriminatory language, and we are already using it for revision of our core documents. And it's one clear example of how timely and useful it could be.